So welcome to HiNZ 2017, and we're talking today to Cliff Hawkins from Fisher & Paykel Healthcare. Cliff, welcome.
Thank you.
I know you spoke yesterday at the conference about the Internet of Things and a Sleepstar solution. Could you tell us some more about that?
Sure. Well, it really started for us to solve a problem where healthcare systems are coming under increased pressure to cope with the increasing numbers of patients and keep costs down at the same time. And that cost of healthcare, it really drove a requirement on the payers of therapy to have providers provide objective evidence that their patients are actually compliant with their therapy. So that was a really tough challenge for us to solve. And in the past, we placed these USB drives into our devices that recorded all of the sleep data, and patients had to bring these sticks with them to their physician whenever they did clinical follow-up. And it was a bit clunky, and the problem for us when we designed our Sleepstar device is that we knew it really had to connect with patients and with providers in a more accessible way. So the solution that we imagined was one that gave time back to the providers, so they didn't have to worry about managing gear. Just my notes here. And the perfect solution was really, allow them to focus on managing the patients they care for and not have to worry about provisioning USB sticks or provisioning modems or anything like that. So we placed Internet of Things technology in the device so that it just magically works in the background to get that data up into the cloud, so it's accessible and available at any time.
Now you mentioned the providers. So who are the providers in this application?
In this application, your healthcare provider might be a physician, might be a clinician, or it might just be a dealer that actually sells CPAP devices.
And how does it actually work? How is the solution?
So the solution works for a patient. You wear a mask every night, and a machine gently pressurizes your airway to stop it from collapsing. And data just happens to be data's recorded just as you're sleeping and summarized, and then in the morning when you press the off button, that data is just wirelessly beamed to an app on the patient's smartphone, so they're able to see objectively how they did last night and compare that to the night before. It's able to tell them whenever there's any common therapy issues. So if their if their mask is leaking air, it can tell them that's happening, and it can show them videos on how to clean their mask or maybe how to fit it properly so that they get a better seal and get a better therapy. And then on the provider side, they can run reports to drill into more detailed data, and they can have a look at the efficacy numbers to see if their treatment's actually being effective or not. And so by putting Internet of Things technology into the devices, we have access to the data all the time, every night. So every day that data's coming in. And so what we've been able to do with that technology is to analyze that data as it comes in and classify it. So we have a rules engine that looks at efficacy numbers and compliance numbers, so that when the healthcare provider comes into work, they sit at their computer, it already tells them which patients they can bill for right now, which are the ones that are doing good and meeting those compliance targets for their insurance company or their government or whoever's paying for that therapy. And it also tells them which patients aren't being treated effectively, so they can actually do clinical follow-up and proactively bring those patients in rather than wait for the next 6 monthly visit.
So this solution, it's the device and all of that. Is it being used in production? Is it in trial mode?
Yeah, it's all in production.
It's in
so
production?
we released the solution, must have been July this year, into Australia and New Zealand. Just went to Canada last week, and next week it's going into Japan. So we'll be rolling this out to more and more countries as we go on through the next 6 months.
And what has been the experience, because it's fairly recent, if it's only July, in New Zealand?
Yeah, the feedback has been fantastic. So from the device itself, from a usability point of view, there are a number of improvements, and from opening the gear itself is much easier for patients, particularly since a high number of OSA patients are actually in the over 50 bracket. So
excuse me, OSA?
OSA, obstructive sleep apnea.
Okay.
Yeah, a lot of them are over 80 years old, and many of them have arthritis, so we made it a lot easier to open, to clean the gear, and to put it all back together. So we had really good feedback on that. From the healthcare provider side of things, they really love using our software to manage the gear, because they don't have to think about how it works, it just does. So from the initial experience when a patient first comes into the clinic, we've got apps where they can have the patient fill in all their own details, and when they walk in to see their physician, those details are right there waiting for them. They can use that app to scan the barcode of a CPAP device and have that automatically be provisioned for them. It activates the SIM card, so they don't have to worry about managing any of that gear. It's very hands-off, and it's really appreciated with solving that problem of treating more patients for lower cost.
And particularly, you mentioned to the more the elderly patients or whatever, so their tool they need the smartphone, and then the app is loaded onto their smartphone, is that right? And then
Yeah,
they
that's
get
right.
some training as to how they...
So the app is an optional thing, and some patients are more engaged than others, and the whole goal of the app is to really boost that engagement, because a lot of people want to know more about their therapy, but they had no way of doing it. The on-screen display of the device is designed to be very simple, and on our Sleepstar device it's able to give them some basic numbers, but if they want to learn more and to be able to see trends over time, to really look maybe how I'm going over a week or a month or the whole year, I can actually notice insights into my therapy and see that cause and effect relationship between what my behaviour does and what my therapy outcome is the next morning. So for example, alcohol or even the time of night I go to bed, all of those things, they really do contribute.
And how long typically would an OSA, a patient be using the device, through the sort of, is there a cure?
There is no cure.
There is no cure.
There is absolutely no cure yet for most people. The gold standard treatment is CPAP therapy, which is that positive airway pressure. So the machine just splints the airway open with gentle pressurized air. So if you're unfortunate enough to have OSA, you're going to be using that device every night if you're wanting to see any benefits from the therapy. It's not a therapy where you could use it, I'm going to be really good this week and next week I'm not going to use it. You'll just go back to square one.
Right, okay, so it must be used all the time. It's like
That's
it doesn't work in the jar, it's got to be used.
Yeah, and that's
the application, and so the equipment that they get in terms of what they're using, that's it's a one-off for them. Once they have it, that's theirs. Is
Once
that
they
right?
have it, that's theirs, yeah. I mean, there'll be consumables, they'll replace their mask because it's something that's in
it's a
contact with
mask.
their face,
right, okay.
So that'll be replaced from time to time. But you can see how by needing to use this every night, why people who pay for this therapy want some proof that it's actually being used.
Well, it sounds like a fascinating application. Are there any others of similar type methodologies in the pipeline with Fisher and Paykel to this solution?
Well, absolutely. So this is the first time we've ever done any software for a patient, and the feedback has been immense. So some of the feedback I had recently is that one person was able to have a discussion with his family about his condition in a way that he never could before. He was able to show people, look, this is happening to me. This is what it means when I have high leak. And I know for you it just sounds like it's making this noise as it's shooting out my face, but actually it means I'm not getting proper therapy. So it's really important to recognize that. So using this tech, we're looking at all of our medical devices in our product portfolio and seeing what other applications we can use to educate our patients, because the research shows that well-supported, well-educated patients are having better outcomes on therapy.
So that's where the sort of the patient engagement continuum comes in, and then engaging with caregivers or family or others for them better understanding.
Yeah, right from the physician to the patient and the data that connects them both. It's really just enabling a dialogue and a discussion. And it improves, obviously the therapy improves the quality of life for the patient, but this connected data is improving the quality of time with your physician, because you're not worrying about setting up gear and just rushing them through, getting them home as fast as they can so you can bill for them. You can actually talk to them about what this therapy means.
What it means.
Yeah, and what it's going to be like day to day, because the condition's not going to go away.
That's great. Thank you so much, Cliff. It's really interesting, and best of luck with it going forward in Japan and other markets. Thank you very much.
Thank you.